In this video, I'm going to be covering the first superficial muscles of the gluteal region. Actually, muscle, just only one muscle in this video, which is the gluteus maximus. In other videos, I'll be covering also the gluteus medius, minimus, and tensor fascia lata. But for our purposes, let's go ahead and then talk about the origin, insertion, blood supply, nerve supply, and also the action of the gluteus maximus. I need to hide it really quick here just to show you the origins. The first origin is the posterior gluteal line, which is located in the posterior surface of the ilium. This is a posterior gluteal line. The other origin is a sacrotuberous ligament, like so. And from the dorsal surface of the sacrum and the coccyx as well. So this is the coccyx here. This is the dorsal surface, sacrum here, and the dorsal surface as well, as you can see here like that. Okay, let me go ahead and get it back here. Gluteus maximus. So these are the organs, and it inserts in 3 different locations. In the gluteal tuberosity of the femur, and mainly in the iliotibial tract. And this is the iliotibial tract here of the fascia lata. But I need to hide this one really quick here to show you where it inserts on the femur. Okay, yeah, that will give a better view. So this is the this area is the gluteal tuberosity, and the lateral lip of the linea aspera. Let me go ahead and hide it real quick here. Okay, so this is a gluteal tuberosity, and the muscle inserts in the lateral lip of the linea aspera here in this area. Alright, let me go ahead and get it back. So the nerve supply to the gluteus maximus is the inferior gluteal nerve, and the root value is L5 and S2. Let's take a look at that. I need to hide it because you cannot see it like that. There you go. So that's the nerve. That's the inferior gluteal nerve. And the inferior gluteal nerve comes off of the sciatic nerve. And as I said before, the root value of the inferior gluteal nerve is L5S2. And the blood supply, there are 3: superior gluteal artery, inferior gluteal artery, and the first perforating branch of the profunda femoris. So let's go ahead and take a look at that really quick here. This is the superior gluteal artery, and down here, oh sorry, that's the inferior gluteal artery. So superior gluteal artery, inferior gluteal artery, and there is another branch that I couldn't find with this software, and that one is the first perforating branch of the profunda femoris. So it's a good habit to trace your arteries back to their origins. So the inferior gluteal artery basically comes off of the internal iliac artery, and the internal iliac comes off of the common iliac, and then the common iliac comes off of the common iliac, and then the abdominal aorta here. Same thing with the inferior gluteal artery. Let's take a look at this. This is the inferior gluteal artery here. We can trace it back to the internal iliac, and then common iliac and abdominal aorta. It basically it extends the thigh. or the trunk when the limb is fixed. Better view here like that. As you see here, the limb is fixed and extends the thigh. It's also a lateral rotator of the thigh, and that makes sense because it inserts in the lateral lip of the linea aspera. So let's take a look here how it laterally rotates. That's a lateral rotation of the thigh. And the upper fibers may abduct the thigh as well. So let's take a look at this abduction of the thigh. Here you go.